We'll be starting the session in just a moment. If you have any connection or technical issues, try refreshing your browser first. If this doesn't work, please go to the Help Desk by clicking Sessions on the left, or click the People tab on the right and search Help Desk to send a private message. Thank you for joining us.
Welcome everyone to the fourth week of our Menus of Change Leadership Summit virtual series. My name is Allison Reiter and I'm an assistant professor here at the CIA's beautiful campus in Hyde Park, New York, where I teach a variety of nutrition, food safety, food systems, and public health courses. You'll have a chance to hear more from me about how the CIA is preparing our future food industries in a breakout session later. But for now, I'm pleased to kick off today's program. I'd like to start off by commending the planning team for an amazing launch to this virtual series, with a sold-out audience tuning in live and Hopin each week, and many more checking out live stream and recorded webcast. If you joined us for any of the previous weeks, welcome back. And if you've missed any sessions, don't worry, you can still check out the great content with our on-demand recordings on our website at menusofchange.org. This pivot to a virtual platform that has enabled us to reach so many more people wouldn't have been possible without the generous support of our sponsors. So thank you to our platinum sponsor, Kellogg's Away from Home, our gold sponsor, Land O'Lakes, our bronze sponsors, Nestle Professional and Oatly, as well as our supporting and corporate sponsors. Their sustained support of Menus of Change helps us bring this programming to you tuition-free, and we hope that you'll make a point of visiting them in the expo section. Before we dive into this week's content, a reminder that you can access all the presentations and recipes on our website with the email that we sent to registered attendees earlier this week. Additionally, we hope that you'll take advantage of the networking opportunities we've created within this environment so that you can still connect with your peers and industry colleagues in real time. This week, our networking topic is all about learning how you communicate to your customers about the impact of their food choices on their health and the health of the planet. We'll also have a Meet the Author booth featuring David Katz and Hooni Kim. Books will be available for purchase in the expo booth with the authors, along with the opportunity to meet them live during the break. We encourage you to participate in as many of these activities as possible in the spirit of community and sharing that is always central to the CIA conferences. And if you participate each of the 6 weeks, you'll have a chance to win free registration and travel to next year's conference in Hyde Park, New York. Additionally, we'd love to hear what's going on in your operations. So we've built out some polls in the polls feature, which we'll be coming back to throughout today's sessions. In fact, our first polls are up and running, where we're asking you to weigh in on the topic of our first general session around red meat's impact on human and environmental health and your recommendations for reducing red meat on your menus. Last week, we heard from a wide variety of chefs, operators, and scientists covering topics ranging from the impacts of the pandemic on the restaurant industry to strategies for building a more resilient food system to best practices for climate-friendly menu design. I was particularly inspired, as always, by the food team at Google in their breakout session about how they are advancing balanced, plant-forward food choices in cafe dining across the world. And this week, we'll take a deeper look at the current state of the evidence on red meat reduction, as well as opportunities for menu innovation around carbohydrate quality through the CIA's new carbohydrate flip approach. You'll also get to participate in one of 5 amazing breakout sessions on these and other related topics. So to kick things off, I'd like to welcome to the stage Sandy Lamott, medical producer for CNN, who will be moderating the first general session. Welcome to the stage, Sandy.
Thank you, and thank you for Menus of Change for having me. And hello, everyone, and welcome to this session dedicated to red and processed meat. You know, that tasty stuff that we all love to eat so much. Unfortunately, nutritional science has told us for decades that eating too much of it isn't very good for us. Studies have linked red and processed meats to all kinds of unpleasant outcomes, such as heart disease, cancer, type 2 diabetes. So when a series of studies that were contradicting that science landed on my desk in the CNN Health Department last September, I was immediately intrigued. The studies were authored by a newly formed group of international researchers. They called themselves Nutri-Rex. They claimed to have graded the quality of existing research on red and processed meat and failed to find, quote, any certainty that eating those meats caused cancer, diabetes, or heart disease. I thought that was surprising, but as a health reporter, I'm sort of used to all of the scientists arguing about study methodology. Just think how many times we've been told that eggs are good for you and bad for you and good for you and bad for you. Science is always changing and evolving. But this new group went further. They decided to create guidelines for the public to follow. In fact, they issued what they called, quote, a weak recommendation based on, quote, low quality evidence that many people don't need to reduce red and processed meat consumption. Most people, they said, can continue to eat the meat they like. And that sent some red flags flying for me. Nutritional guidelines are typically created by US government or the World Health Organization or well-established professional groups such as the American Cancer Society or the American Heart Association. So it was quite unusual for an unknown group of international researchers to join together and immediately decide to educate and issue guidelines for the public, especially when they were the opposite of what existed. And there was another red flag. As I looked at the background of some of the members of Nutri-Rex, I saw that several of them, including the co-founder, had previously received money from industry, particularly the beef industry. Now, that might not necessarily negate the quality of the research, but the optics aren't good. At CNN Health, for example, whenever we see that a study is sponsored by industry, we pass and don't report on it, unless it's a huge controversy, which we knew this would be. Now, at CNN Health, we typically get at least one knowledgeable expert not involved in the study to comment on it before we write and publish. In this case, I received the study on a Friday and spent the weekend interviewing the authors of the study, the editor of the journal that was publishing it on Monday, and over a dozen national and international experts in the field of nutrition. We're lucky to have three of those gentlemen with us today. Christopher Gardner, a professor of medicine at Stanford's Prevention Research Center, who conducts randomized clinical trials on nutrition. That's no small feat, by the way. Dr. David Katz, the founding director of Yale University's Prevention Research Center and founder and president of the True Health Initiative, a nonprofit dedicated to the science of a healthy, sustainable diet and lifestyle. And Dr. Walter Willett of Harvard's T.H. Chan School of Public Health, known internationally for his decades of research on the link between nutrition and disease. I won't say how many decades because he looks so young, so we'll all just have to look that up. He's a member of the Institute of Medicine of the National Academy of Sciences. That's a really big deal, by the way. He's received many national and international awards, and he's a best-selling author in addition to writing some 1,700 scientific papers. Dr. Willett, I don't know how you had time to do it, but I believe you've prepared a presentation for us on the science behind red and processed meat, so I'll turn it over to you now.
Good afternoon. I'm pleased again to be having a chance to communicate, even though unfortunately we're not able to be together in Hyde Park. And I do look forward very much to being able to do that next year at our Menus of Change meeting. In this session, I'm going to talk about red meat reduction and the implications for health and well-being. It's an area where there's been a lot of confusion. We're honored to have with us in the session Dr. Chris Gardner, and he's going to talk about red meat alternatives, which is a very hot topic right now, so I'm not going to say much about those. A very simple, perhaps obvious issue is that we make choices every day. And it's usually not just do we add red meat or do we add chicken or tofu or fish to what we're having for a meal, but it's usually an issue of substitution. If we're going to have red meat, we're not going to have something else. If we're going to add some fish, it's going to be usually because we're not going to have something else. And it may seem obvious, but it's an important principle that's often been ignored. And I'll come back to that in our talk. And these choices, of course, have huge implications for our health and well-being, and as we'll discuss, for planetary health as well. There are many ways to look at the issue between red meat or other foods in our diet and our long-term health and well-being. And I'm going to take us through some of the steps, the layers of evidence that we've considered when we've drawn conclusions about what would be the healthiest choices. At the very beginning, the most simple kind of way of looking at this is just what's the composition of these various sources of protein. And we've known for a long time that saturated fat in the blood increases our blood cholesterol. High blood cholesterol levels lead to higher risk of heart disease and higher risk of death. On the other hand, we've known that polyunsaturated fats reduce blood cholesterol and reduce heart disease rates. So the ratio of polyunsaturated to saturated fat, or the PS ratio, is for many years been a very consistent way of evaluating the quality of fat in the diet. So we can look at the PS ratio in different foods, and they're very different. Beef has quite a bit of saturated fat. I think everybody knows that. But beef has very little polyunsaturated fat, the good fat, in our diet. And so that ratio, as you can see on the left, is very low. Chicken, surprisingly, has quite a bit more polyunsaturated fat, so that ratio is a lot better. Salmon, even more polyunsaturated fat. But if you really want to get to high PS ratio, you would go to the plant sources of protein, such as almonds, tofu, and lentils. So just on that basis alone, the very simple composition of red meat, you would think that the plant sources of protein would be advantageous in relation to heart disease risk. But of course, that's not enough to make decisions, because these plant and animal sources of protein contain many other factors that can influence health one way or another. For example, beef has a lot of cholesterol in it. The plant-based protein sources have none. Beef has other factors such as TMAO, which we're thinking may increase the risk of heart disease. That's work in progress. So we can't just look at one number. So we've gone on to look at other kinds of data as well. Next slide, please. And this refers to randomized studies where we actually give people different foods in their diets for a few weeks and look at changes in blood cholesterol levels or blood pressure or inflammatory factors. And quite a few studies have been done looking at the effect of red meat in relation to blood cholesterol and other risk factors. Now, this is a meta-analysis of several dozen studies that were randomized trials with red meat versus something else in the diet. If we look at red meat compared to just the usual diet, as you well know, the usual diets in America is not so healthy. It contains a lot of refined starch, a lot of sugar, until recently quite a bit of trans fat. So it's not surprising that red meat doesn't raise like LDL cholesterol, the bad cholesterol, much more than does the average American diet. But that doesn't mean that red meat is good for us or it doesn't have any effect. It just means it's as bad for us as the rest of the American diet. If we compare red meat to other animal sources of protein, the middle bar there, it's sort of a wash. So that error bar there shows there's no statistically significant difference. But in the studies that compared red meat directly to healthy plant-based protein sources such as legumes, soy, and nuts, there was a clear increase in LDL cholesterol on a higher red meat diet. So again, that would lead us to hypothesize that red meat would increase risk of heart disease. But again, that kind of evidence is not enough. And others have done many studies looking at other risk factors besides LDL cholesterol. This is a summary of over 60 randomized trials giving different foods and looking at their effect on a wide variety of risk factors for heart disease, including, as we talked about, LDL cholesterol, total cholesterol, blood glucose levels, insulin resistance, and blood pressure, and then rank the foods by their overall effect on these risk factors. And as you can see at the top, we have mostly plant-based protein sources. The worst, of course, is sugar-sweetened beverages. There's no nutritional value, but red meat and other animal source foods come in at the bottom, whereas not so long with legumes, lentils, fruits and vegetables, and fish come in much higher in terms of healthfulness, ranked by a whole variety of risk factors. But again, what we'd really like to look at is actual heart disease and mortality itself. So we've conducted long-term epidemiologic studies, and this is just a timeline of the long-term studies we've collected. I won't go into detail, but they involve over several 100,000 men and women with many repeated measurements of diet over the years. And we're able to control for risk factors like smoking and physical activity when we want to look at how red meat or something else influences disease risk. When we looked first a number of years ago at red meat in relation to risk of heart disease, not surprisingly, given what I've showed you already, there was increasing risk with higher red meat consumption in the diet. This kind of study has been repeated by others now around the world. This is a meta-analysis that was published last year, and very consistently, whether it's unprocessed red meat or processed red meat, there's increases in total mortality, total cardiovascular disease mortality, cancer mortality, and type 2 diabetes. And these are all statistically significant. Now, some people have said those 8% or 10% lower risk if you reduce red meat by 3 servings a week. That's not a very big reduction, but this is just 3 servings a week. A lot of people are eating a lot more than that. And also there's other limitations in these kinds of studies. Most of them measured red meat intake just at one point in time, which would tend to underestimate the effect. But if a drug had all these benefits that reducing red meat would, excuse me, if a drug had a similar effect, it would be a blockbuster drug. To go back to my first slide though, what really is important though is the comparison with red meat versus other choices in the diet. And so we've done that kind of analysis. And what we see is replacing poultry with red meat, about a 20% reduction in risk with a swap of 1 serving per day. Fish for red meat, similar reduction. But the biggest benefit is replacing plant sources of protein, such as nuts and beans, with for red meat. There, 1 serving a day swap may be a 20 to 30% lower risk. We've gone on to look not just at heart disease, as I've showed you, but total mortality, diabetes, stroke, and as well as coronary heart disease incidence. And basically replacing low-fat dairy, nuts, fish, poultry, virtually any other protein source for red meat is related to lower risk of all of these outcomes. Again, swapping these for red meat in the diet. So we can, in some ways, rank the different foods in relation to various health outcomes. This is looking at total mortality. And the line across the middle is the risk for dairy. Higher risk is associated with consumption of unprocessed red meat, but worst of all, processed red meat. But the lowest risk, as you can see, again, consistent with what we've already seen, is for plant protein sources. But it's not enough to know just whether one is better or worse for you, but there's a question of, is there some amount that is safe of red meat or anything else in the diet? So we've done some very detailed analyses. This is looking at type 2 diabetes in our cohorts, combining all 3 studies, over 200,000 men and women, and that includes over a number of years, almost 14,000 cases of type 2 diabetes. And we need those big numbers to look at this with good precision. And we see that even about 1 ounce per day of red meat is associated with a statistically significant increase in risk of type 2 diabetes. So we didn't want to recommend or aim for a level of red meat that is actually associated with increased risk, even though it's sort of modest with 1 ounce per day. So we used for a target number, half an ounce per day, where if there is some increase in risk, it's quite small. Now, in principle, we'd like to do a kind of study where we randomize people to high red meat or low red meat, maybe plant-based protein instead of red meat, and follow people for many years. We do not have such a study and probably never will be, because we'd have to include many thousands of people and keep them on those diets for many years. But people are people, and they don't always, in fact, quite often don't stay on their assigned diets. And that's probably why we will never have a study that we would theoretically like. The closest thing was the Randomized study in Spain, which included a reduction in red meat. There was a benefit, but lots of other things changed at the same time, including more nuts and extra virgin olive oil. So we can't say for sure that it's just the red meat. Probably other factors contributed to the benefit. Now, a lot of confusion has been caused by a study you may have heard about that came out almost a year ago in the Annals of Internal Medicine. And this was meant to be a summary of all the published data on red meat and health outcomes. And Their conclusion was, in their press release, no need to reduce red or processed meat consumption. Now, that flew in the face of recommendations from the American Heart Association, the American Cancer Society, the U.S. National Guidelines, many other groups made. So what's going on here? Of course, this headline, no need to reduce red or processed meat consumption for good health, was meant to be sensationalist. But there were many problems with that paper upon which that conclusion was based. First of all, the authors ignored the randomized feeding studies looking at cardiovascular disease risk factors that I described, and that's a very important part of the evidence. They also discarded their own meta-analyses showing increased risk of cardiovascular disease, diabetes, total mortality, and other endpoints because they were not based on randomized studies. And they said the results were trivial, even though, as I mentioned, though that would have been the basis for a blockbuster drug. They discarded other kinds of evidence just because they thought the effects were too strong. I could talk about the limitations for hours here, but there were many and very fundamentally serious. Of course, we don't use that as a criteria for smoking, that continue smoking because you like to, or unsafe sex, go ahead because you like to, but that was basically their logic. The problem with this is that if they use this criteria that you need to have long-term randomized trials with health outcomes as the criteria for giving recommendations, we will never be able to really give recommendations about many important things. For example, the same group published a paper in the same journal just a couple of years earlier saying that guidelines on sugar intake do not meet criteria for trustworthy recommendations and are based on low quality evidence. Again, because you can't have the kind of theoretically desirable study that you want. Next slide, please. The fallacy in this kind of logic that you can't give any guidance without randomized double-blind trials was illustrated by an interview with the author, essentially the father of this system called GRADE that is used to evaluate pharmaceutical drugs, which you can do for which you can do randomized double-blind trials. And Goya was asked by a journalist for The Atlantic after this report came out and said, basically, could a doctor recommend a salad compared to a bowl of sugar? And Goya responded that the quality of evidence is so low that it depends on, almost surely it depends on their personal preferences. So if you can't distinguish a bowl of sugar from a salad, is this really the kind of guideline, the kind of criteria, the kind of person that you want to have making dietary recommendations? I suspect not so. Of course, this is menus of change, and we need to look at everything we do through an environmental lens, as well as a lens looking at the direct health effects. And as for red meat, looking at the greenhouse gas production, I think everyone is aware that it's really off the charts. Here, as shown, this is a meta-analysis of environmental effects per serving of different foods. We see that the greenhouse gas emissions per serving of red meat is many times, 10 or 20-fold, even compared to dairy, pork, or some other animal products, and as much as 50-fold higher than the greenhouse gas produced by the agricultural production of nuts, legumes, fruits and vegetables, and other plant sources of protein. So as a takeaway, largely replacing red meat with plant protein sources, and optionally, if you would like, modest amounts of fish, poultry, and dairy foods will reduce the risk of coronary heart disease, diabetes, and total mortality. Unfortunately, the beef and dairy industries are conducting an orchestrated campaign to sow doubt and confusion, abetted by some sensationalist journalists and editors, unfortunately, even now, medical journals. Thank you.
Dr. Willett, that was a fascinating presentation, but I'm going to have to ask you about your ending comment there, where you said that the beef and dairy industries are conducting an orchestrated campaign to sow doubt and confusion, and it's abetted by some sensationalist journalists and editors. That's a pretty strong statement. I'm going to have to ask for some specifics on that.
Sure. Can you hear me now?
Uh-huh. I can hear you.
We're all connected here. We're all over the country. Good. Yes, of course, it's no surprise that the industry is conducting these orchestrated campaigns. They have their PR people. They use their influence in many ways. They lobby heavily in Congress. For example, the last time around for the dietary guidelines, 2015, the beef industry actually got an act of Congress to say that the dietary guidelines could not even consider anything about the environmental effects of their recommendations, which is like putting on blinders that we're supposed to pretend that there's no environmental effects of our food choices. But I think what's really unfortunate in this case, and it's unfortunately not the first case, that even a medical journal, Annals of Internal Medicine, which is the leading journal of internal medicine. When I was practicing internal medicine, that was my, not sure what's out there, that was my go-to journal. But clearly this was a sensationalist grab for readership. All the journals, of course, are under pressure at this point in time. But as you heard, this same group of authors, same editor, same journal, 2 years ago, 2 years ago, lots of interesting voices in our background here. They published a journal exonerating sugar. And a couple years before that, they exonerated saturated fat in the diet. By using the same kind of idea, you didn't even have to do any research, any literature review. We knew that you couldn't do a randomized trial of red meat and cancer or red meat and coronary heart disease. But they took almost their whole journal to come up with this sensationalist conclusion. First of all, the editor of the journal allowed them to proclaim, the authors to proclaim new dietary guidelines. And really none of these authors have published in this area at all. They were researching in other unrelated areas. And even there, probably none of us would have said too much, except for the journal then itself proclaiming in their press release that new dietary guidelines, basically eat whatever amount of red meat you want to. That's irresponsible journalism. And in fact, Scientific American carried a story a couple months later about this and proclaimed this was irresponsible editorship. I think the editor should have been fired because it wasn't just one occasion. This is repeated sensationalist, irresponsible editorship, misleading physicians who read the journal who don't really have the depth of knowledge about the nuances of all these studies. And then, of course, this has gone on into the general media too. And here I have to mention the New York Times, supposedly our leading newspaper, really picked this up as a major story as well. Deep in the story, there were some caveats and some cautions, but the headlines clearly is what most people look at. And the New York Times has done this before, for example, proclaiming on the first page and repeatedly that it's not a problem to be overweight or moderately obese. And we then, a couple of years later, published a paper that included over 200 prospective studies from around the world, about 8 million people, and they buried that deep in their paper. So the public is not getting a balanced view of the actual evidence out there. Newspapers, including the best medical journals, are going for sensationalism. And I must say, CNN, before I knew you were going to be on this program a few months ago, I made a slide giving your headline as an example of a responsible journal. You did cover this story, but you put it in balance, in context.
Thank you. I appreciate that very much. We try to very hard at CNN to do that. So I'm curious, Dr. Gardner, does this orchestrated campaign really inflict damage on a consumer point of view on red meat, do you think?
Well, I certainly think nutrition comes up quite often as being one of the more confusing topics. I don't think it's that way. I get to hang out with David Katz and Walter Willett. David started the True Health Initiative partly to show that among the nutrition health community, there's widespread agreement. I've actually been on multiple recommendation groups where I'm often stunned how much agreement there is within the group. But for the public, yes. So when this actually came out, there was a Menus of Change University Research Collaborative meeting, I think almost that same month. And Greg Drescher asked me if I would spend 6 minutes trying to give my perspective. there were several in the audience who said, wow, that was really helpful. Can you give a 10-minute talk for us? Then somebody said, can you give a 20-minute talk for us? So I actually got a lot of love for trying to explain the confusion that I didn't think was going to be that big a deal, but I got a lot of requests to explain it because people were confused. Yes, I think this orchestrated campaign has an effect, and that's what we were all trying to prevent as we head toward that specific publication. So you're talking to a very engaged group here.
So Dr. Katz, what's to be done about this? I know you've talked about the controversies around this and how they've done their studies using this method called grade in the past, but what's to be done about trying to fix this kind of sensationalism, as Dr. Willett puts it?
Yeah, well, a lot, Sandy, and you are a big part of the solution. We really need healthy relationships at the interface of science and media. The public needs to understand, this audience needs to understand that everything we know about nutrition doesn't change with each study. It's an incremental addition to what we knew up until this morning. We don't throw out everything we knew up until this morning. Hey, there's a new news cycle, start again at zero. Science doesn't work that way. That's part of it. I think something like the True Health Initiative, which is devoted to generating a signal audible above the noise, is an important new method. The idea that there's massive agreement across the expanse from vegan advocates to paleo advocates about the fundamentals of a healthy, sustainable diet. We all agree with one another. People who know what they're doing in nutrition, we agree 85, 90, 95% about all of the relevant content. Just, when you're invited to do an interview, the part you talk about is the 5%. Here's what makes me different from everybody else. And then that's the final bit. The problem, and by the way, this relates to many of our issues with the pandemic as well. What's new in the world is the internet, and the fact that not only does information travel faster than ever, but so does misinformation. And Sandy, as I'm sure you know very well, we have multiple studies showing that misinformation travels better and faster because it's more titillating. It's designed to be clickbait. It's designed to be provocative. If 10,000 people tell you again, eating processed meat isn't really good for you or for our fellow creatures or for the planet, it's yesterday's news. If one comes along to say, not so fast, that evidence is not reliable, we scored it a particular way and we reached the opposite conclusion. Headlines everywhere, everybody is batting that around in social media. So we really need to conjoin science to sense. And frankly, I think that's where the grade metric fails, because it implies there's only one way for human beings to understand what's true. And by a show of hands, how many of you are parents? I can't see a damn thing where we're, I don't know where the audience is. I'm assuming a lot of you raised your hands. Well, how many of you advised your kids, not to run with scissors? And now ask yourselves, did you ever read a randomized controlled trial on that topic or a meta-analysis? I mean, so much of what we know reliably is based on observation and pattern consistency. So the idea that, in nutrition, the only way to answer a question is a randomized controlled trial is just silly. The public needs to know that. And I think once we combine science and sense, it'll be much easier for credible scientists to advance the understanding of the public without running afoul of these provocative, titillating, and misleading headlines.
Well, thank you for that. I have to say, though, that, considering the epidemic of obesity that we have in the country, I'm not sure Americans listen to good advice, regardless of who says it, or maybe not even bad advice. And so I just want to ask Dr. Gardner, for example, how much impact do you think nutrition science actually has? Or do you think that perhaps, chefs and restaurants and what they put on their plate has more impact?
Yeah, well, I think that's why it's super important that we have all the chefs online today, and hopefully even some personal trainers. I was once humbled by someone who said, you know what, Christopher, almost nobody's read your papers in my neighborhood. They all listen to their chef or their personal trainer or their uncle. But I know a group of personal trainers that are following me and listening and asking for advice. I think the Menus of Change is just an incredibly fabulous example that the chefs are partnering with the scientists. I think the whole thing that MOC set up that Walter and Greg Drescher started here with. Let's have a science board, a business board, and a chef board to find the intersection of where these are all at. That is the future, finding all the different stakeholders in this and aligning them. I don't think we've done as well as we could have in the past. And I think things like menus of change are doing that in the future, so that if that message was more consistent and there was a taste factor built in with the chefs, and there was an economic viability factor built in by the business leaders that was consistent with nutrition and health, that is the very definition of menus of change. And I think that will have an impact.
Amen.
Okay, well, you know, the Culinary Institute of America has just done a survey, and they found that nearly half of all of us are now aspire to eat less meat in some way, and 80% are open to eating less meat. And so that sounds like really good news, but I'm just wondering, Dr. Willett, based on all of your years of experience, is that just kind of a little drop in the bucket of good intentions, perhaps?
Mm-hmm. Well, I think it's more than a drop in the bucket. That's a pretty high number. We do have to realize that change doesn't occur overnight. One of the other areas I've worked on throughout my career is smoking. And back in 1960s, I actually, as a medical student, sold cigarettes in the university teaching hospital at the University of Michigan, believe it or not. I mean, it was accepted in those days. It's just unimaginable now. But there's been a profound change, but it didn't happen overnight. It took the efforts of many people, many different organizations, education, taxes, lots of kinds of levers to help people move toward a state. And that's added years to the average life of Americans. And we have seen red meat consumption go down quite a bit from the 1970s, actually, about a 40% or so on a per capita basis. So those are big changes. They don't happen overnight. But I think there is an acceleration of change in this direction. This half aspiring is a big number. And a lot of that is the younger generation. Of course, they're going to be around longer than we are. So that change in demographics will have a big impact. And if we look at the restaurant industry, I am told that most of the major growth in the last few years has been in the healthful aspect, more plant-forward part of the restaurant industry. So there is a shift going on.
Mm-hmm.
Sandy, if I could jump in there too, just, you know, again, the
we only have about 5 minutes left.
Yeah, very briefly, just, you know, the juxtaposition with tobacco is valuable because that war is being won with a combination of empowering individuals with consistent, reliable information. Tobacco is bad for you, and also policy. And we really ought to be thinking about all the options at our disposal. We've had very high profile publications indicating that the American food supply is willfully engineered to be addictive. That hides in plain sight. You know, that calls out for regulation and policy to level the playing field. So again, the tobacco wars are informative. And, you know, when you look at the campaign to confuse people, you know, the merchants of doubt have been around for a long time. They've just changed their commodity.
Mm-hmm. Dr. Gardner, you have just done a study about that a lot of people are interested in these plant alternative meats. And you've just done something on Beyond Meat, which takes us and so I'm wondering if you could tell us a little bit about that. We don't have much time. We might have to come back to it again in the breakout session.
Yep.
But if you would tell us a little bit about what you found.
So this is one of these perfectly aligned issues. So if we say red meat should go down, what should go up? Right. Should it be cheese pizza? Should it be vegetables? I'm all for whole food, plant-forward diets. We know that people's culinary tastes often default to the familiar. And so there's a lot of people who wouldn't switch from red meat unless it was something that looked and tasted the same. So there's been this surge in availability of this. If you could forward to the next slide, whoever's handling the slides. This is a small study. It just came out yesterday, actually. I'm not going to be a sales pitch person. This was Beyond Meat that we worked with. They had no influence in the design. They just really wanted, honestly, some scientific answers. They do incorporate saturated fat with coconut oil. They do have some sodium to flavor it. They've made it look and sizzle and smell and taste like red meat. Better for the environment, definitely better for the animals, but there's been a question. Could that saturated fat and sodium be bad? They actually have more fiber than red meat, which has none. They have no cholesterol because they're plant-based. And so we decided to do a study with 36 people that had for 8 weeks 2 servings a day of Beyond Meat versus 2 servings a day of red meat. And I won't have time to go into detail, so can we go to the next slide? I'm just going to jump to the conclusion. Dr. Willett had mentioned this new emerging risk factor, trimethylamine oxide, which is the precursors come in red meat. They're not in Beyond Meat. This is our main result table here, where we found that TMAO not unexpectedly was better with the plant meat versus the red meat. There was the LDL cholesterol question, which actually went down on the plant meat versus the red meat. Pretty easy to explain. There was a little less saturated fat. There was more animal protein. There was more fiber, and kind of unexpectedly in just 8 weeks, they lost a couple pounds when they were on the plant meat, even though we couldn't see a difference in calories or physical activities. So the most significant finding was actually a very consistent but small decrease in weight. And so we actually had 3 health benefits to the plant meat versus the animal meat. No adverse things. Blood pressure did not go up on the plant meat, even though there's sodium in it. So we needed a study like this to look specifically at health benefits. There were health benefits. Is this the best choice for red meat substitution? No, this is one alternative. And so as we're looking for what to be instead of, we didn't have an answer to this question before. And now this needs to be replicated, but we have one answer. And these are the kinds of nutrition studies we need to do. And these are the kinds that we can help inform the culinarians in the group. Are these viable substitutes? Great if you're going to have a lentil salad, but what if somebody wants something that looks, smells, and tastes the same? This is viable to consider right now, not just for the environment and animal rights and welfare, but also for health.
Right. Well, one of the gentlemen in the audience, Ken Toon, has asked what are some of the best ways to influence the culture of consumption of red meat. And I'm thinking that we're going to have to take that answer and talk to it in our breakout session. So I hope that everyone will follow us along over there. But perhaps we could get started with just one quick answer from you, Dr. Gardner.
Oh, for changing that? Yeah, I think it is the working with the culinarians. That is my favorite thing now, is to work with chefs as partners, so that we're working with individual taste factors and behaviors and delight and joy. My favorite line from Greg Tresher is, let's work with unapologetic deliciousness and pair that up with nutrition science.
Okay. Well, I think we're going to be moving on to our breakout session now, where we'll be able to take all kinds of questions from everyone in the audience. So please join us for that. Is that right?
Yes, it is. Thank you so much, Sandy, Drs. Willett, Katz, and Gardner for joining us and for helping us get through some of this confusion and understanding all of these different studies coming out. As Sandy mentioned, we're now going to breakout sessions, which you'll be able to access from the Sessions tab on the left side of your screen. And I've got a slide to share with you here showing you where to find that. We have an incredible lineup of content across our breakouts, and we'll be posting recordings of all of the sessions on our website, so you don't have to miss out by going to just one. Some of these sessions will have dedicated time for audience Q&A, as Sandy mentioned. For instance, if we didn't get a chance to get to your question around the red meat confusion, hop into that breakout session so that you can ask that of the doctors. And we hope you'll jump into the conversation by hitting your green share your audio and video button when prompted. Just before we scatter into our breakout sessions, let's see how our poll is doing. I've actually been tracking the poll numbers as we've been going through this section. And one thing I think is really interesting was that a lot of people didn't think the science was settled before we came into the session. And as we went through the session, those numbers around I consider the science settled and science is settled, but how much red meat is okay started to inch up a little bit. So really glad to see that a lot of people either consider the science settled, or actually that people do consider the science settled. Sounds like there's still a little bit of confusion around how much red meat is okay. So maybe head into that breakout session and ask your question and help resolve some of that confusion. You'll see that we also have a new poll up, which hopefully will get you excited for our next general session, looking at the carbohydrate flip here on the stage tab. That's happening at 11:35 Pacific, 2:35 p.m. Eastern. And until then, have some great conversations in your breakout sessions and enjoy the networking break.